Hello, everyone. My name is Camelia. I'm a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And I'm actually getting on here because I've done a series over the last couple of months on performing a psychiatric interview. And the last video that I did was about a week ago, and I said that was going to be the last video. But after kind of going through that again, there is some information that I thought would be good to highlight or to share as an addendum to the last video that I shared. And we've talked about quite a few things: the chief complaint, the patient's psychiatric history, family psychiatric history, social history, medical history, substance use history, and more of the presenting symptoms from the patient. And that was the last video. But I do want to talk about some of the things that you will learn to observe as you are getting more information and as you are asking the questions that I've talked about in the previous videos. There's another video I did a while back on active listening. And so a lot of this really ties into the skill of active listening, because what you're going to be able to do over time is not only ask those questions, but really get some of the psychiatric exam while you're actually talking to the patient. And that is really nonverbal, and it's all in what you observe from the patient. But the psychiatric exam is what I want to focus on. I do want to specify that, looking at the patient's cognition, are they alert and oriented? Do they appear to be fatigued? Are they confused? You also want to touch in on their general appearance. So what does the patient look like? Do they look like they've been taking care of themselves? Are they well groomed? Are they disheveled? You really want to pay attention to that so that you can get more context as to what's going on with the patient. Their speech. So with speech, you want to pay attention to their tone. You want to pay attention to whether it's clear and it's intact. You also want to pay attention to whether they're hyperverbal. Do they seem a little bit more, chatty than usual? Or do they have pressured speech where their words are sort of one on top of another? And you really just want to get some insight there, because their speech can tell you a lot of things. And there are certain conditions that, speech changes in speech can be very telling for different diagnoses. You want to look at the patient's rapport. You want to, understand, are they guarded? Do they appear to be guarded? Do they have good rapport? Are they open, to discussion? I also ask the patient specifically about their mood. So what I always ask patients is, how would you describe your mood? I actually put that in my mood section in quotations. And that gives you what the patient's mood is, but you also want to take that a step further and look at their affect. So affect is the observable expression of the patient's emotion. What's important here is does the patient's affect, what you're seeing, is it congruent with what they're telling you? Do they have a, depressed affect? Do they appear to be restless or fidgety? Are they more anxious? That would be what you would be documenting with the affect of the patient. So remember, it's the observable expression of the patient's emotion. You also want to pay attention to thought processes. Do they have tangential thoughts? Are they circumferential? Are their thoughts linear and goal directed? So when you ask a question, is the patient able to tell you the answer to the question, and does it appear to be linear, and does it appear to answer the question? That will give you lots of information. Their thought content really plays into whether there are any delusions, any obsessive thinking, and this is where you want to pay attention to any thoughts around self-harm, suicidality, and homicidal ideations. Patients, believe it or not, will tell you if there are things more present here, but you also want to ask them, has there been any planning or intent around these things? So if patients say, yes, I've had these thoughts, they've been passive, or they're active, thoughts of self-harm, thoughts of, suicidal ideations or homicidal ideations, you want to take that a step further and ask about Has there been any actions? Has there been any planning, or is there any intent around those thoughts? That will give you much information, but it also tells you as the provider what to do next. So you really want to know, is this a safety concern? What should we be doing to help this patient while we have them in the office or while we have them here for the visit? Be sure that you have a very robust plan for any safety concerns. That means being sure you have an emergency contact person on file, being sure that you have your maybe your assistant or the staff that you're working with to follow up with the patient. Sometimes it's necessary for you to send the patient on to the emergency room. Whether they're willing or not, if there is a safety concern, we do have to, follow through with that. So really know ahead of time. I would just suggest to have that robust thought process, planning process in place, so that you are able to assist the patient while you have them in the office. Because once they leave, many times it's much more difficult to track the patient or to kind of understand what's going to be needed for the patient. And then you want to pay attention to their concentration, their attention. Are you able to keep their attention? Do they seem to be distracted? Those are all very important things that you want to pay attention to. So I wanted to sort of give this again as an addendum to what I've already talked about. This is more of the psychiatric exam. So that's what you're actually going to be kind of doing as you go along and ask all the questions that I talked about and referenced in the previous videos. But it's a huge part and it's more telling. It tells us a lot of information. And this is really where the active listening comes in, guys, where you are paying attention to those nonverbal cues and you're able to get more information to really support and assist the patient in their treatment. Some of you may have found some other ways that you've found useful, helpful as you've done your psychiatric exam. So please share, as always, if you have any, hacks about, what to do or what's important to do, or if you have any questions, feel free to comment below or definitely, chat down below the video. And I will see you guys in the next video. Thank you.